Thank you very much. Yeah, I'm delighted to share my experience. I hope you can hear me loud and clear at the back. That's a picture of Portsmouth where I come from. It's not as pretty as San Diego, but it's not bad. For England, it's a very nice place on the south coast of England. So my job today is to tell you what Purastat is, but then Tashi's already done it, so I'm not going to go through it again. What does it do? He's told you as well, so I'm not going to talk about it. I'll address the area, do we really need this product? Where to use it? How to use it? And does it work? So very simple questions, and I'll give you very simple answers based on what I know about it. So this is a typical video you would have seen, that this guy has been asked to just blow off the door of the van so that they can get the money out of it. And I asked my fellow to just close the snare so that I can cut that polyp, but you can see that things have gone wrong. He's blown the whole van, and my fellow has cut through the polyp without me putting the foot on the diathermy. So things do go wrong in endoscopy, and we do need something to help us. So that went badly. We don't want scenarios like this. You do see bleeds all the time. This is another scenario. I'm sure all of you who've done a lot of polypectomy have seen this. And we use clips, and the clips are very effective. But if this bleed happens when you've only done half of your polyp and the other half of the polyp still needs to be removed, then putting the clip is a real pain, because now clip is in your way and it's very difficult to remove the rest of the polyp. So although clip is good, but it is very difficult to handle a clip halfway through the procedure. So that's the downside of clip in the middle of the procedure. You must have heard about lots of new products, Endoclot, Hemospray, fantastic powders. There's a big bleed here, and you'll see that we spray these powders and then you control the bleed. So this works, the bleed is controlled, but now there's a snowstorm. I haven't got a clue where the rest of the adenoma is. What else do I need to remove? How do I remove? It's impossible. So again, it's a very good product, but doesn't help me if I have a bleed halfway through my procedure. So again, there is a need here which needs to be met of something that controls the bleed but does not stop my procedure. But there is a thing that we already do. So this is a very vascular polyp, and you'll see that how we had a big bleed. Once you get a bleed, you don't have to put a clip. You don't have to spray these white powders. We use a device called coag grasper. So it's a big bleed, and I'll use a coag grasper, grasp this vessel, and burn it really hard to control the bleed. And you'll see in a minute, it's very effective, and we control the bleed. But you are now cooking on top of the muscle using a monopolar current, so the risk of perforation is very high. And you have to balance how much heat you use. If you use less heat, it will bleed. If you use more heat, it will cause perforation. This becomes even more relevant when you are in the right colon or you are in the esophagus. Stomach is very thick wall, and you can get away with a lot of things, but not in the esophagus, not in the right colon. So that's where my concern with this modality of bleed control is. Although it's very effective, but that's what worries me, to use it in right colon and esophagus. And I think that's where this Purastat comes in. This video isn't working now, but you already heard that this is a peptide-based nanofiber scaffolding there. So when you spray on it on an oozing vessel, it forms this artificial scaffold which forms a physical barrier and controls it plugs in that hole in the vessel, controls the bleed, and then the automatic normal coagulation process takes over, and that plugs that gap and controls the bleeding. So this looks like a very neat way of doing things and controlling the bleed with a transparent gel, and the bleeding is stopped. Where does it work? I think the initial data from the product comes from the surgical side, where it has been used in surgery to control exudative hemorrhages. But we are gastroenterologists or GI surgeons, so we are more interested in exudative hemorrhage in small and large vessel bleeds in GI tract. So I think that's where it should be aimed for any exudative hemorrhage in GI tract. The original data they started using in vitro in the lab when they used it in blood and found that it does clot the blood. That's where the whole concept started. Then there were a series of animal studies where they had brain, spinal cord, nephrectomy, liver, spinal cord injuries. In all these places in the animal, they produced artificial injuries, made them bleed, and used the product to see whether it controls the ooze or not, and it was found to be effective. So that looked very promising. So following that data, it was then used in surgery. So this is the data in cardiovascular surgery where it was used in vascular graft in 33 patients, and they found that it effectively controlled the bleed in 94.5% of the cases, and no adverse event was used. So that gave me a lot of confidence when I looked at it to say it's used in cardiovascular surgery, a product that's directly applied in these big vessels, no adverse events, and seems to be working. Then it was used in rectal cancer surgery, where the 10 patients got this, Purastat and 10 controls, and what they found that it did control the oozing after surgery, but the drain, the volume of drain after surgery was much lower in the Purastat group as compared to the control group, which tells me that the seepage and the secretion that happens after surgery, mostly it's lymphatic secretion, that all went down. So again, and no adverse events noted. So that gives more confidence that when used in surgery, no adverse events. And then finally, in 2014, a group of Japanese gastroenterologists used in a very small sample of gastric ESD cases and found that in 11 out of 12 patients, it worked really well and provided effective hemostasis for them. So that's some sort of evidence which shows that it works and controls the bleeding. So because they felt confident enough to use during surgery and during ESD, so there must be a potential in this product. And so I was more interested in immediate hemostasis. So our work is, we have a UK Purastat registry where we use, the primary aim here is to control the intra-procedural bleed. So when I'm doing ESD or complex EMR, you get bleeding, and we want to see whether Purastat can control that bleed or not. We've done about 40 patients so far, and we found that in 75% of the patients, Purastat alone was effective in controlling the intraprocedural bleed. So I'll show you some examples from this in my next videos, what I mean. So this is a scarred polyp in right colon, which is a very high risk for bleeding because its scarring causes neovascularization. And when you do ESD on these, that is a very high risk for bleed. You'll see in a minute that as you cut, things start oozing, and then you have lots of options of what you can do. There, the lesions just come off, and there's a ooze in the base. I'm in the right colon. I can use coag grasper, but I'm very worried. Now on the base, if I use coag grasper, I can't see the vessel point, so I might accidentally grasp the muscle, and that will lead to perforation. So here, we just drop some Purastat on it, and you can see we wait for about 30 or 40 seconds, and the bleeding stops. And it's transparent. You can see through the gel that the bleeding has stopped, and if it hasn't stopped, you can see the bleeding point. So then you can direct more therapy on that point, and that does not interfere with further treatment. This is a Barrett's tumor. It's about 3 centimeter or more big nodular lesion in Barrett's. And those of you who've done ESD in Barrett's would know that Barrett's is very vascular. The biggest challenge we have in Barrett's is that constantly there's oozing. As we cut, there are lots of vessels, they ooze, and then again you have the problem. So we just done most of it, and then we face this ooze. And you can use the knife, but it's not pinpoint where exactly it's coming from. So I don't want to use heat. So we drop some Purastat on it there, and that controls it. And you carry on. Again, another oozing point appears. You use more Purastat. Because this is a constant phenomenon during ESD. You come across a lot of bleeding points. And you can keep using heat, which is effective, but does carry risk. Instead, we put a transparent gel there. I can see the bleeding vessel has stopped because I can see through it. If it hasn't stopped, I will see